Good evening to all. I warmly welcome on behalf of the College of General Practitioners of Sri Lanka to today's lecture on occupational eye injuries by our very eminent Professor Madhuwanthi Dissanayake. Before we begin, a few housewarming rules. Please kindly keep your microphone off at all times unless you want to ask or raise a question. And any questions are valuable to us, so please put them on the chat box and we will bring it up at the Q&A session. So now let's move on to the main event. It's my pleasure to introduce our distinguished speaker today, Professor M. Madhuwanthi Dissanayake, consultant eye surgeon and Professor Department of Anatomy, Genetics and Biomedical Informatics. She's also the Director, Eye Care Center, Faculty of Medicine, University of Colombo. She will be sharing valuable insights on occupational eye injuries. And we are in for a treat today. So without further ado, I'd like to invite her on this virtual stage. Over to you, ma'am.
Thank you, Shameen. At the outset, I would like to thank the College of General Practitioners for giving me this opportunity to share with you some of the information I have on occupational medicine in ophthalmology. So this is quite an important theme, mainly because of several reasons. We will go into the reasons first. Actually, occupational eye injuries are more common than anybody would think. And the other important thing is they are preventable. So most of the time, occupational eye injuries are preventable. And if we take precautions, most of these injuries would not happen. And the problems that arise from those can be prevented, actually. So the other thing is occupational eye injuries not only happen among the factory workers or the manual laborers, or as some of us would think, among the unskilled laborers. But it can happen in anybody. It can happen in any community. So therefore, we have to be aware of these things and try our best to prevent and treat as soon as they occur, or make the people aware about the prevention. So when you take the eye, it is a very sensitive organ, and the parts of the eye, as you know, can get affected due to injuries in many ways. So as you know, from the cornea to sclera and iris and the anterior chamber, posterior chamber, lens, vitreous humor, the retina and the optic nerve all can get affected due to occupational eye injuries. So it is very important for us to be aware of all the structures that can get damaged during this process. Can you see my cursor? Is the cursor visible?
Yes,
ma'am.
Okay, thank you. So let's go on to the types of eye injuries. In the meantime, as Shameen said, we will have a Q&A session, but if you have any questions regarding any of the slides or anything that we discuss, you can also raise the point at that moment as well. Okay, right. So if we go into the types of eye injuries, we can divide them into physical injuries, which can occur due to blunt trauma or penetrating trauma. Then there are chemical injuries, which can occur due to acid, alkali, or other chemical substances. And there is also thermal injuries and injury by UV light. So out of these, I'll just ask you, which one is more damaging? Is it acid or alkali?
Alkali.
Yes, very good. Do you know the reason why?
No, madam.
Yeah, actually, when the acid gets in contact with the ocular tissue, it will coagulate the proteins. There will be a reaction and it will coagulate the protein, and the further penetration of the chemical would be limited. But in the case of alkali, the penetration will take place even then there is no coagulation of tissue as such, or no barrier formed when alkali comes into contact. So therefore, alkali injuries will cause more damage into the depth of the tissues. Okay. So going into the causes, the common causes of eye injuries as studied by many research studies, the foreign bodies in the eye are one of the commonest eye injuries. So what are these causes? What are these things that can cause? It can be scrap material, waste, wind-blown dust, or flying material, particles from metal, plastic, or cement, or chemicals or chemical products, or falling or misdirected objects, as well as UV light from welding torches. Let's go into some of the injuries and discuss some of the injuries that can occur commonly. So this picture shows you a child with blunt injury. Okay, so what do you think the injury is here? Yes, when you, as a first contact doctor, when a patient like this comes, what would be your approach? How would you approach this patient? Yeah, you can see that yes, so there you can see that there is periorbital edema. So the thing is, we don't know what has happened inside. So it is important to check what is inside. When you deal with patients with injury to the eye, you should inspect and see as much as possible, but you should not exert undue pressure, because if there is a penetrating wound inside, it can cause further damage. So if there is no cut injury or laceration, you can immediately get the patient to get some ice and use cold compression if there is no injury as such from outside. Then slowly you have to separate the lids and see what has happened inside. So this can be the outward appearance of even a globe rupture, or even a blowout fracture, or even any sort of grave damage could be there inside or covered by the lids. So therefore, it is very important, even if you can't identify, or if the patient is not cooperative, or if the child is crying, then it is very important to send the patient for further evaluation, because even if it is a minor trauma, later it can develop into a severe condition. So periorbital edema, it's a result of here due to blunt trauma. So what is this? This picture shows you a lid laceration. So what is the most important thing that you have to appreciate here? One thing is that you have to check whether the globe is intact. Okay, so whether the globe is intact. How would you check whether the globe is intact? What are the features that you would look for? Yes, anybody?
The ocular pressure.
Yes, you can gently check the ocular pressure, not to exert too much pressure, but just digital pressure. Just keep your finger and see, a glove finger, to see whether the ocular pressure is is felt. Okay, so that is if there is no other damage outside. So if there is, if you see that the pressure is low, then you can suspect that there is globe rupture. You have to immediately send the patient to the closest hospital where the exploration and restoration of the globe can be attempted. Other than that, what else can you see? Here you can see that the anterior chamber is well formed, right? You can see it's not shallow, right? So that is one thing. What about the pupil? Yes, the pupil, the shape of the pupil, yes. So it is dilated. So that means there can be some problem with the optic nerve, or because the patient is having sympathetic stimulation, the patient's pupil is dilated. But if it shows reaction, then the optic nerve can be checked with that. But how about the shape of the pupil? Is it rounded or is it irregular?
It's rounded.
Yeah, it's round. So therefore, we can assume that there is no damage in this region. If there was any damage here in the cornea, then due to the pressure, the iris would prolapse through that laceration, and then the pupil will be abnormal, a D-shaped pupil, we say. So the shape of the pupil will be abnormal. Then also you have to check whether there are any black areas. So what does black area mean in this in the scleral tissue? That means the scleral laceration has occurred and the choroid is penetrating, prolapsing through, right? So if there is any black specks like thing, any black thing, sometimes even the patient would think that it is something, a foreign body, and try to remove that. But it is not a foreign body, it is the black colored choroid that is coming out. Okay, so you have to be careful. Okay, so that is about the globe. What about the laceration of the lid itself? What do you notice here?
Involving the lid margins.
Very good, very good. So the lid margin involvement is very important to check. Why is that? If it is not approximated properly, it can lead to notching of the lid. And notching of the lid later, when it scars, when the scar tissue formation occurs, it can cause the cornea to get exposed, and exposure keratopathy is a problem. So we see patients who have undergone lid laceration repairs in places where the proper microscopic facilities are not available. If they approximate the lids without the approximation of the gray line with the margin, if it is not sutured in layers, it can lead to notching of the lid and later cause blindness due to exposure keratopathy. So it is very important, if the lid margin is involved, you have to send the patient for repair under a microscope where facilities are available. Before that, you can stop the bleeding and put a sterile dressing and then send the patient. Also remember, if the lid is involved like here, always you have to explore and see whether the globe underneath this area is penetrated, or whether there is any globe rupture or any damage to the sclera there. Okay, right. Okay, next picture will show you what is this condition. What do you see here? Yes, it's a subconjunctival hemorrhage. That's right. It's a subconjunctival hemorrhage. So subconjunctival hemorrhage can be due to many reasons. It may be due to injury. It may be due to different other reasons, including increase in intraocular pressure or uncontrolled hypertension, or even sneezing, coughing, any of these can cause rupture of the subconjunctival vessels. So, but after an injury, it is very important to check whether the posterior edge of the subconjunctival hemorrhage is visible. What does that mean? If the posterior edge is not visible, that means a skull fracture may be involved. So because of that, blood may track down. So therefore, if the posterior margin is not seen, better to get the history, proper history, and also do imaging to see whether the base of the skull fracture is there or not. Okay. So you can also get subconjunctival hemorrhage like this. So in this situation, you have to, there is extensive subconjunctival hemorrhage, and you can also see that the cornea and the anterior chamber is also shallow, and there is extensive injury. So in this situation, in the casualty, what we do is get the patient into the theater, and under anesthesia, we have to explore and see whether there is any laceration of the sclera. If it is there, we have to repair that. Otherwise, the patient will lose vision. So this type of extensive injury, you have to send the patient for further evaluation. Okay. What is this condition?
The subtarsal foreign body.
Yes. Have you seen this type of patients in your practice? What is your experience? Patients will come, yeah? Yeah, patients. What is the complaint of the patient?
Irritation.
Very good. Yes, irritation and sometimes redness, but there is also irritation which is persisting. This is a place, the subtarsal foreign body is a common occurrence even after patients coming from walking on the road. When the insects come, they go and get lodged, insects or foreign bodies, metallic or non-metallic foreign bodies, especially during paddy harvesting season. Paddy husk can get in and get lodged in this region. This is the subtarsal region. So unless you invert the lid and check for this, these will be there. So occupational hazard for farmers. Okay, so unless you check this and remove this, it can lead to a corneal ulcer. So always when there is a patient with red eye and irritation, persistent irritation, usually conjunctivitis also will give some degree of irritation, but persistent irritation, you have to invert the lid like this. You all know how to invert the lid? You have to keep a pen or a cotton bud at the end of at the lateral end of the upper lid, and then pull the lid holding the lashes like this. Then it will get inverted. Okay, so that's a skill everybody will have to, all the doctors need to learn how to do this, because unless you do this immediately, the patient will be in real discomfort. So once you remove that, you can do it even in the field or in your surgery or in your office. You can do it. You can then remove it with a cotton bud or a forceps, or even something clean. You can remove this. So when you see this, it's very important to remove. Otherwise, it can, if it gets retained, it can lead to a corneal ulcer. Right. So next time, if the patient comes with persistent irritation, you have to do this and see. Right. And then afterwards, give an antibiotic ointment because already there is damage and it's more prone to get infected. Okay. What is this? That's a corneal foreign body. If you get a patient like this in your office, in your practice, what would you do for this patient? He has a corneal foreign body. It can be after a industrial injury, or even going in the train. Sometimes the patients can get this. What would you do?
We have to refer to an ophthalmologist.
Very good. Yes. Because corneal foreign bodies has to be removed. Otherwise, the patient gets pain and irritation. And if you leave it there, it can get infected. But if you try to remove it without proper equipment and without the slit lamp, it can actually cause more damage. It can cause damage to the cornea, which will later get infected or give rise to astigmatism. Or the other thing is, you can penetrate the cornea and then enter the anterior chamber, and you can cause an infection. So therefore, you should not try to remove this corneal foreign body. You have to refer it to an ophthalmologist. Okay. If you don't remove it in time, sometimes patients come late. Then it is like this. The rust ring will remain. So we have to give antibiotic ointment and get the patient on a subsequent visit and then remove this, because with the growth of the cornea, with the cells, it will come to the surface and then we have to remove. Sometimes in industrial situations, occupational injuries, those days where the quarries, when the patients were exposed to explosions, a lot of foreign bodies would be there on the cornea. Now we don't see them much, but corneal foreign bodies, that's a very real nuisance to the patient, as well as if there are multiple foreign bodies, it's very difficult to remove. One by one you have to remove. Okay, but it has to be done under the microscope or the slit lamp. So refer the patient to an ophthalmologist. So sometimes if you leave the subtarsal foreign body, patient can get a corneal aberration like this. Sometimes even contact lenses can get lodged like that. So you have to remove them, see and remove. Corneal aberrations can occur due to any reason. It can be due to the minor, even an edge of a paper can cause this. But the problem is, you can treat them with an antibiotic ointment and they will heal. But the problem is, after some time, again, they can have a recurrence of the situation, because the surface epithelial cells will not be strong enough to hold on to the corneal stroma, and then they will get dislodged, especially in the morning. So we call it recurrent erosion of the cornea, recurrent erosion. So therefore, to prevent that, you have to give them lubricants for a longer period. So maybe 1 month or 3 months, you have to give lubricants, ocular lubricants, tear supplements to be used at night so that they heal properly. Okay, right. So what is this? That is a injury to the cornea, corneal laceration, and you can see that the iris has come through this. So iris prolapse, right? And there is iridocorneal adhesions between the cornea and the iris. And as I said before, what is the shape of the pupil? It is a D-shaped pupil. Yes, so this is a D-shaped pupil. So you know that there is extensive damage to the globe. So you have to refer this patient, right? Okay. Right. What is this condition? Have you seen patients like this?
Hyphema.
Yes, this is hyphema, that is blood in the anterior chamber. So if there is blood in the anterior chamber, you have to refer the patient to an ophthalmologist. This can result from blunt trauma, but the problem is sometimes the hyphema is not extensive like this. It is only a tiny meniscus here. at the lower pole here, right? At 6 o'clock position, only a tiny meniscus. So you have to be very careful to see whether that is there, because the problem with hyphema is they can have a recurrent bleed. And if the patient doesn't rest and if the patient is not treated, especially children, they can get recurrent bleeds. And the problem is the pressure in the eye, the intraocular pressure can go up, and also if it is extensive, corneal staining can occur. Okay, right. So this is another patient coming with damage to the iris, as well as it has caused damage to the, what is this structure? Lens. Okay, so it's a traumatic cataract. So the thing you have to know is, as soon as the patient presents to you with an injury, first thing is get the brief history and then check the visual acuity. We have to check the visual acuity because sometimes immediately after the patient can develop, the lens can go into a traumatic cataract. Within about 1 to 2 days, it can go into a traumatic cataract like this, and the vision will be very much impaired. And the other thing is, you have to, as much as possible, see the back of the eye, funduscopy. Otherwise, you will not be able to see the fundus of the patient to see whether there is any damage or not. So you have to check the visual acuity, and at that time it is important in this kind of situations, because sometimes the patients can claim that they had good vision before injury, and then after the injury the vision was impaired. So because of that, as soon as possible, it is very important from the legal point of view also to check the visual acuity. And because of this cataract, the patient will lose vision immediately after. So you have to send these patients for further management. Right. Then vitreous hemorrhage also can occur. You will, although you try to check, the vision will be low, and when you try to check, you will not get a proper view of the fundus. It will be a black reflex. Okay, so that's a vitreous hemorrhage. Anyway, if the vision is poor, or if you cannot visualize, or if you are in doubt, always better to refer the patient for further evaluation. So this is a disc hemorrhage, optic disc hemorrhage, again can occur due to blunt trauma. So when you see the fundus, you will see that there is extensive hemorrhage there. So not only the eyeball, but the orbit can get damaged due to trauma. Blunt trauma can cause this damage, this injury. What is this? It is orbital flow fracture. So what is the characteristic feature here? If you get a X-ray also, you will see that the flow is damaged, and this sign is called the teardrop sign. So in this CT, you can see that it's like a teardrop. There is prolapse of the orbital contents into the maxillary sinus. Okay, if there is bleeding, you will see that the maxillary sinus is involved here. But in this patient, it is the teardrop sign that you see. On this side, on the left side, the orbital flow is intact, but on the right side, you can see the teardrop sign. So in this situation also, it's important because the patient will present with double vision, and also it's a vertical double vision, okay, because the extraocular muscles will be involved. Anyway, initially when there is periorbital edema, it is difficult to assess. So sometimes even if the patient doesn't complain initially, later on, if the patient, after the edema settles, if the patient still has double vision, then you have to image the patient and send the patient for evaluation and management, because after about 2 weeks, if there is fibrosis around this region, it is difficult to release these muscles. So therefore, the patients that you suspect of orbital flow fractures, you have to send them immediately, that is within 2 weeks, for evaluation and further management. Okay, otherwise the patient will be having this double vision lifelong. Okay, so that is the end of the first part of the lecture. So next we will go into more into the occupational health aspect, right? Do you have any questions from the previous slides, or shall we continue? Shall we continue then? We'll have
Yes, ma'am.
Okay, so we'll have the questions at the end. So let's get on with the eye safety at work, which is our main topic today. So creating and maintaining safe working environment is the responsibility not only of the employers, but the employees. So it is a team effort, team effort, right? So both employers and employees will have to be responsible for eye safety at work. So what are the responsibilities of the employers? Employers will have to initially conduct an eye hazard assessment. Actually, you will also be, if you are an employee of the factory, then you will, on behalf of the employer, the doctor in charge will have to help with this. So what are your responsibilities? You have to conduct an eye hazard assessment, whether there are any places or equipment that can cause an eye hazard. Then use the engineering controls or the teams there to remove or minimize the hazards. Also, it's the responsibility of the employer to provide properly fitting protective eyewear. Okay, so providing protective eyewear is the responsibility of the employers. Also, in addition to these, it is the responsibility that there is a first aid point or eye wash point where if there is any problem, they can actually go and immediately attend to the problem. So the first aid point should be provided by the employer. Then what are the responsibilities of the employees? They have to use the protective eyewear given and encourage the other workers also to use them, and also be on the lookout for new eye hazards and notify the supervisor. So those are important things that need to be done. So it is everybody's responsibility. Then as we discussed earlier, this eye safety is important because eye injuries can impact everyone, not just the injured worker. For the injured worker, it can be the pain, discomfort, medical cost, loss of work time, loss of and also the permanent disability, as well as his or her daily living, family interactions, and recreational activities will also be affected. But not only for the worker, for the employers also, it will be the impact, it will impact the productivity of the whole process, and the worker morale will go down if they don't take these things seriously, and also the legal cost and compensation cost will be the problems for the employer. So next we get on to the types of eye protection. So therefore it's the responsibility of everybody. So we need to know what type of eye protection is important. So for each type of work, there are different types of eye protection. So for example, there can be safety glasses. The basic one is the safety glasses, sometimes with side protection and shields. There can be goggles and face shields, and then there are welding helmets, full face respirators. So this is the range. So if you take the safety glasses, they are designed to withstand the impact. from different objects. Then they will also have protection from flying particles if they come from the sides. They are usually used as protection against impact and also low intensity optical radiation. Then we have goggles, which are stronger and used for high impact particles and chemical splashes, and also for welding, to prevent welding light affecting the eyes. Then next, we have face shields. They are used even for higher impact tasks, and they will protect the wearer's face and eyes from critical chemicals, bloodborne hazards as well. Then there are separate welding helmets, which will protect the user from the intensity of welding light, which can cause severe burns to the cornea, as well as it can damage the surrounding eye tissue as well as the retina. Sometimes the workers don't use them and they come with all kinds of complaints. So it is important to select the appropriate eyewear for the appropriate job. So the USA regulations has this particular standard, that is Z87 should be there on the marked on the protective eyewear. So Z87 or Z87 plus should be marked on the protective eyewear, right? So these polycarbonate lenses will have impact resistance, and that is why it is the standard is there. Otherwise, even if the workers use some type of substandard protective eyewear, they will not be protected against the impact. So therefore, it's important to check the standard Z87. Then also it should be properly fitted and comfortable to wear. Then they should also see whether it's individually. It's important to check whether now if the patient is already having glasses, and if you ask the person to wear goggles on top, sometimes it is not possible. So therefore, you have to work accordingly. Sometimes you can have the correction made into the personal protective eyewear as well. So there are different mechanisms depending on how important that is for the protection in that particular area. So it's very, you can customize and then make the different recommendations on different types of work. So sometimes glasses, as we said, are not enough. Sometimes even the patients are using glasses, but from the side, a particle has come and hit the eye. Sometimes the problem is when they, it is difficult to wear the glasses. You need some kind of straps to hold the glasses. Otherwise, they will not be in the proper position. And also, sometimes what the people say is it is not comfortable. It's hitting the eye and hitting the nose, and it's uncomfortable, and they don't wear. The other thing is sometimes when you must have seen, when they wear the glasses, it fogs and the visibility is less. So therefore, they don't wear. So there are things that we can do to overcome these problems, such as having different small adjustments. So for the comfort, you can add different nose pads or something, which can be done in collaboration with the manufacturing people. You can actually do that, attempt to do that, so that the people in your company or in your industry would benefit. So not only that, you have to have you can have the anti-scratch coatings, and you can have the anti-fogging coatings. So make sure that these are appropriately used in these situations. So just because the patients are not wearing, you cannot put the blame onto the patients, but the workers, but you have to inquire into why they are not using. So it is the responsibility of both parties. Then about storing the protective eyewear, that is also important, taking care of the protective eyewear. So how you can do that is instruct them to put the protective eyewear after use into a cloth bag or an old sock or something, and then you can put it in the back of the car or somewhere, or in a bag or somewhere. Otherwise, if you just put it in the among other tools, it can get damaged and they will not be able to use it. And also cleaning the protective eyewear is important. So you can wash and wipe with a soft clean cloth, and also use anti-fog solutions to keep the lenses from fogging. So it is very important to go into detail and see that they are using this protective eyewear. Other thing is keep the bystanders out of work areas. Sometimes it's not the person who is working that gets the damage, but the onlooker. So therefore, you have to minimize the outsiders coming into that hazardous area. And also, until the work is fully completed, you have to keep the protective eyewear on. And also, keep the jutting out tools and equipment or those things in a proper way. Instruct the workers to keep them out of danger. The potential hazardous working areas have to be lit. For example, the dark areas with hanging or jutting out equipment is a very dangerous area. So protruding objects have to be covered, or there should be some flag saying that in a red cloth or something, or properly covered so that they will not hit the eye of another worker. Then the workers need to remember to keep the protective eyewear until they leave the site. And also, if there is any doubt about any type of protective eyewear, they have to bring it to the notice of their supervisor. And sometimes contact lens users will have more problems. So they will have dust and chemicals causing problems for their contact lenses. So they have to be specially advised on how to use them. So it is very important to look into each of these people's work and have an understanding of what they do. They may be scientists, they may be engineers who are working with small microchips. We have had so many patients coming with several injuries from the workplace. So you have to, from time to time, go and educate these people on preventing eye hazards during working environment. So next, you have to educate them on caring for eye injuries. What to do if suddenly an injury occurs. So that is also very important to prevent further damage. So every factory or work area should have an eye wash station. So especially the places where they have chemicals, they have to have locations where eye wash is available. So everybody need to know that. And then emergency sterile eye wash solutions should be available for the use of the workers. If nothing is available, they need to know that any clean water or clean drinkable water is good for the immediate use. So they need to know the basic first aid techniques. So you have to educate them on basic first aid techniques to prevent further damage in ocular injuries. So if the workers get any dust or something foreign body in the eye, what should they do? They should not rub the eye. They should flush the eye with large amount of water and then see the doctor come to you if the speck is not washed out, or if pain, redness, or vision is impaired. Then you have to then what to do if there are cuts, punctures, or breaks in the eye. Do not wash the eye. Do not try to remove the object. If something is stuck in the eye, with the object in situ, you have to send the patient to hospital, and in the theater only it will be removed. Then if there is any chemical injury, flush the eye immediately with water or any drinkable fluid, and then continue flushing for at least 15 minutes. And while en route to the doctor also, they have to wash the eye. And if it has any contact lens, flush the eye even if it has a contact lens. So sometimes the contact lens may get dislodged, but you have to pay special attention. Then any blows to the eye, any blunt injury, apply cold compress without pressure. So ice water soaked in a clean cloth should be kept over the eye. But there shouldn't be any undue pressure. So that is the important message you have to give. How to do eye wash? This is one way you can do. Otherwise, you can have the patient lying down and have a kidney tray on one side, and then put saline, have the saline going into the eye and do the irrigation and eye wash. What is the important thing if the lime particles get into the eye? Sometimes these lime particles, although you do the eye wash, it may not get totally removed. So you have to inspect the eye and remove them sometimes, which may be in the subtarsal region or in the lower fornix even. So these lime particles, even the paint and other things may contain this lime particles. So you have to remove them. Otherwise, the alkali will cause further damage in the eye. So that is the end of that part. Now have a look at this. Is this a good way of protecting the eyes? No. That is your idea. No, it is not. So you have to make sure that the proper eyewear is used during that procedure. Okay. Just before we wind up, I think, Shamin, it is important to talk about a little bit about the computer vision syndrome, because that is also now has become an occupational hazard for many of the workers. So as you know, occupational, lot of computer users will have the features of this computer vision syndrome. What are the features? It can range from eye pain, eye fatigue, headache, double vision, not only eye symptoms, but neck pain, arm pain, even backache, and even depression and irritability, aggression even, all that can result from this computer vision syndrome. So to prevent that, you have to advise the patients to think of these precautions. So at the Eye Care Center, UCFM, we have come out with this small message, be smart for eye health. So to remember what you have to advise the patients. So you can remember this, be smart. So B is for background. That is, you have to have the computer located in a proper background with background light coming from the left upper corner of the person, and also have minimum sound and minimum disturbance for them to work properly. Then ergonomics, that is, the monitor should be at a lower level from the eye level, just slightly lower but not higher. And then the distance from the computer should be, if it is a phone, it should be 1 foot. If it is the computer or a laptop, it should be 2 feet. If it is a TV, it should be 10 feet. And also you should sit in a proper chair where the arms can be rested and with the legs touching the floor at the knees at right angles, okay, at 90 degrees. So ergonomics are also important. Then S is for you to remember to wear the spectacles. If there is any vision impairment, you have to always wear the proper spectacles. And dry eye is another problem that is associated with the computer vision syndrome. So if it is a problem, the doctor will prescribe tear supplement. So use that if it is necessary. That is the S. Then modifications will include modifications of the screen, anti-glare screens, and also the modifications you can make in the font size and the background. So those modifications, remember to do those things. You can always enlarge the magnify and get it the way that is comfortable for you. Then A is for adequate hydration. It is very important to drink adequate amounts of water. So adequate hydration is important, especially children and older people, and also people who are having other problems such as even antihypertensives and even patients who are having rheumatoid arthritis and other conditions are more prone to get dry eye. So therefore adequate hydration is important. Then regular breaks. So that is the thing that everybody knows, that is 20-20 rule. So every 20 minutes you have to take a break and look at a distant object, 20 feet away, look at something distant. And then for 20 seconds, you have to keep the eye fully closed, right? So that blinking will enable the tear distribution in the eye, and also the lubrication will be better if you take regular breaks. Then also the 20-20 rule will remind you to take this break, and this will break the accommodation. Otherwise, always you are looking at a very close object. So 20 minutes, you break that and look at a distant object, and you give a break to your ciliary muscles where the accommodation is relaxed. Then T is for screen time. So as you know, there are recommendations by different professional organizations, including the American the Pediatrics Association. So they have given recommendations for under 2 years. There shouldn't be any screen time allowed for the very small children. Then 2 to 5 years, it's only 1 hour. Then 5 to teens, it's only 2 hours. So even for adults, the out of office hours, it should be limited to 2 hours. Screen time should be limited to 2 hours. So if you follow these advice, and if you follow these points, then the computer vision syndrome can be avoided. So that is from the Eye Care Center Faculty of Medicine, University of Colombo, we have come out with this Be Smart and Avoid Computer Vision Syndrome. So with that, I think I have come to the end of the lecture. We can go for any questions. This is further reading. If you are interested, you can get more information from this. Hope you have gained some insight into this topic.
Definitely, madam. That was very interesting. Each and every slide was so informative. We do have a question in the chat box. So Dr. Hassar asks, is there a place for steroid eye drops in combination with antibiotics following foreign body removal?
Is there a place for steroid eye drops in combination with antibiotics following foreign body removal? Generally, no, right? Because steroids will now, as you know, will have an effect on the immune response. So therefore, if a foreign body is removed from the cornea, then it is generally only a antibiotic eye drop that we give. But it may, generally that is the rule, but if the eye is inflamed or depending on the discretion of the eye surgeon, it may be used, but generally I wouldn't advise any steroid drops to be combined with antibiotics in the case of a foreign body removal, because we do have a break in the mechanical barrier there. So that is a very dangerous situation. Even if if a fungus is introduced to that break, that it can go into a ulcer, a fungal ulcer, and if the patient is a diabetic, the immunity will be again compromised. So it's a very, very not a very advisable thing to combine steroid eye drops in the case of a foreign body after the foreign body removal. Just antibiotics would be quite, it will be quite suffice, it will be quite adequate for the healing of the patient's corneal deficit there, corneal problem. Yes. Would that answer any other queries? But generally, yeah, in conjunctivitis, we sometimes combine steroids, because in conjunctivitis there is no break in the mechanical barrier as such. So therefore, in conjunctivitis, steroids are given, but again, if you give steroids, the patient has to be monitored, because as you know, steroids can cause a lot of problems. We know that even doctor's brother lost his eye because he was given a steroid and antibiotic combination because of a fungal ulcer. So it's very dangerous.
Madam, I have a question with regards to subconjunctival hemorrhage at a GP practice.
Okay.
What do we do? Like, what's the point we refer?
Yeah, it's a very common thing, and also it's an alarming thing for the patient, because the eye is red. Usually the subconjunctival hemorrhage, usually the patient doesn't notice it initially. It's somebody known to them, somebody who will see the patient that will ask why your eye is red. So it is actually when the patient gets that, we have to assess the patient for increased intraocular pressure, increased hypertension, and also any other reasons for a patient who is not having any injury to the eye. So the answer to your question would be, if there is any injury, better to refer the patient. Otherwise, if you know that the patient has had hypertension and or the patient has had sneezing or coughing or anything like that, and that was the reason, then you can give actually a tear supplement even would be adequate, but you have to monitor the patient. When we also would do investigation if it is a recurrent thing. If it is only once, the first time occurrence, we will not do any investigations. But if you suspect that the patient, if you can see the fundus, and if the eye pressure is also no history of eye pressure, and the fundus also is not having cupping, then maybe you can treat the patient and then refer later if there is any concern. But if the patient is having any doubts, or if you have any doubts, always better to refer. Okay.
Okay, thank you, madam. So I think that brings us to the end of this session. I think we don't have any more questions. So thank you, madam. Thank you for your valuable time on this Saturday night. I'm sure there are a lot of things you would wish to do, but thank you for taking time for us and all our trainees and colleagues. I hope we surely did learn a lot of things. Each and every slide was so informative. Thank you once again to you, ma'am, and thank you to all the participants who took their time to join today.
Thank you, and all the best to you.
Thank you, ma'am.
Night.
Good night.